I just wanted to be here with you, let you get a little of the sunshine with me because I am elated that with this episode, I am preparing you for the summer episodes. And the summer episodes are going to allow us to go a little deeper into what we've been experiencing during the spring. You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold pressed juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences. Where a lot of that grit is done, we'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. Hello, it's me, Dr. Jewel. I'm outside. I said, what better way than to introduce the summer to you? All right. I may not stay in the whole time, but that's okay. I just wanted to be here with you, let you get a little of the sunshine with me because I am elated that with this episode, I am preparing you for the summer episodes. And the summer episodes are going to allow us to go a little deeper into what we've been experiencing during the spring. So, before I go any further, I just want to say thank you so much for being part of the Cold Press Conversations community. You have been exceptional. You have been exceptional. And I thank you. You know, I really want you to be even closer to this community where you are now going to be like a member. Wouldn't that be amazing? I think it would be. That way, you can seek knowledge and understanding, elevate that health discourse, and make a difference in your own health journey, especially those who are around you as well. Because our intention is to be that legacy, something that allows us to move even closer into being something special to those who we love. Now, I'm going to have three things I'm going to focus on today. The first one is about gaining a deeper understanding of how our health impacts us. The third one is about advocacy. And the fourth one is supporting the initiatives that are around, like health equity and accessibility. But before I go any further, I want to let you know that with much thought, I decided that there will not be any additional guests this summer. No, not any additional guests. I've decided to give a little instruction, teach you, take you back to school, summer school, so to say, and that we will have a few books that we will have that we'll share with each other. And I just want you to gain some insight as to how to use some of the information that I am going to be giving you. Over the next season, as well as how to even go back to the former episodes, the past episodes, so that you can gain even a deeper insight as to how what they spoke about is relative to who you are today. So I've given you a little bit of sunshine already. I'm going to go back in. Give me just a moment and I'll be right back. Okay. Hey, I'm back. I am no longer outside. I'm inside. I am ready to give you all of the juice. All right. So I just want to say it was great being outside. I don't know if you like being outside, but I know I like being outside. And I said, what better way than to start the summer and these episodes that I'm going to be giving you outside, you know? So I did give you just a little hint that I'm focusing on three particular things, and hopefully you got a little insight in it. But I'm going to go ahead and repeat some of it because ultimately I want to make sure that you know that this episode is to get you to think about three top things. The first one is about gaining insight on health topics that impact you and your community. The second one is about advocating for informed decision making. And the third one is promoting health equity and accessibility. So that when you're supporting these initiatives, you're seeing some changes that are happening in your community. Before I go any further, I think it's important for me to just make sure that I share some things with you. The first thing is the reason why I'm doing this summer, and I'm taking you back to the university. Okay. I want people to feel like, oh, I'm getting this information because you are going to be getting this information. Is that my intention is to give you a little lesson here and there, but to gain all of the insights, I have crafted a membership that I think will help you gain even more insight as to what I'm discussing, how you can learn more. But each of the episodes that I give to you this summer will, at least for the next 5 to 6 weeks, you will gain some insight as to how you can elevate your own health discourse, your own health care, as well as your community, so that you can make a difference for yourself, for your family members, and for your community. Because that's what we want. Cold Press Conversation is to make sure that we are taking everything that we have learned from the guests and finding ways that we can make it applicable to our own life. And that's one thing that they did. The guests gave us information that we need to stop, take heed of, and digest. Once we digest the things that they have given to us, how can we place some of these things and put them in action? Or how can we learn and evolve from it? And where can we gain more insight where we are? Because a lot of our guests are all over the nation as well as Canada that I did have. And a lot of them may not be in your neighborhood. And if they're in your neighborhood, I highly suggest that you go out and reach out to them because that's what they want you to do. And I'm going to give you those access to how to get to them as well with the membership. But before I go any further, I want to talk about the top three so that you can gain the insight of how what the guests gave us is applicable to who we are. So I'm going to break it down just a touch so that we can get the first things first. And the very first thing I want to discuss with you is gaining a deeper insight into important health topics that directly impact who you are and your community. Because what we're doing is we're looking at the issues. We're discussing the issues like local healthcare resources, preventive care options, health initiatives that are within your community so that you can understand how to improve your own health income. And I said income because we invest in so many other things. We invest in cars, we invest in homes, we invest in everything else you can think of, clothing, food. When you gain knowledge about how to best care for yourself, then you have made an investment in your own health. And that is the income of an outcome. And that's the way I look at it. Because when you invest in yourself and you place those nuggets in who you are, you become a better person in this whole realm of healthcare. It's not easy caring for self, caring for others, more or less a community. And so that's the reason why I wanted to have that discussion with you about local resources. Like, where do you get them? And that's one of the things I want to kind of discuss. You have healthcare resources in your community. You have something called a community services board that's out there. You have your local health department. You also have some places that are 501c3, the nonprofits, such as your free clinics. Those are places where you can get some additional resources. If you have a loved one who has been in a hospital, there's a case manager that's there, and they're there to kind of help you in this process to make sure that you have the appropriate resources for your discharge, to make sure that you are doing your best when you get out so that you do not have to be readmitted, because we don't want that. No one wants that because we want the best care for what we have. That's why they have rehabilitative services that are there. And that's another form of resource for people. So those are options that you can do, but it goes deeper than that. Okay. It goes deeper than that. Preventive care options. So what do I mean by a preventive care option? And I'm talking about the options of getting a mammogram, the option of going to your cardiologist, the option of going to your endocrinologist. The endocrinologist is the person who helps you with your diabetes. Okay. Cardiology is the heart, someone who works with your heart, who helps you to understand the best services of what's happening with your heart. You can go to your dentist to get your teeth cleaned. Okay, that is a healthcare option to get your 6-month checkup. Some people have to go 3, some have to go 6. It depends on what kind of care you need for your health, for your teeth. You also have your ophthalmologist to help you with your sight. Those are options in which you can help better yourself. Gynecologists. Okay, we're talking about a plethora of other people out there who give us preventive care. You know, I did not mention it on this past 15 episodes, but there is a place that I found not far from me that was pretty interesting. They focus on physical therapy, and it's a health check physical therapist. And I'm using the term loosely to kind of help you understand because they go into deeper terms. So what they do is they take the patient, who would be you, and they do an assessment of how you move. And from there, they give you a plan of what to do to make sure that you stay fit with your physical health. I thought that was ingenious. Okay. We have people out there, I'm talking about providers and practitioners, who want to see that you have preventive care options for your own physical health so that you can move and function every day. And the other part of gaining that deeper impact of your community are the community health initiatives. And a lot of times you can gain some of that insight by some of the flyers that you may see in your local grocery store, your CVS pharmacy, excuse me, or your pharmacy. Sorry, I have no one who is endorsing me there, but I just want to give you heads up that you can find out what they have that's local in your community. You know, one thing that I do know is there are several places that offer a health fair. Local churches give health fairs. You have your actual county that may give a local health fair. Sometimes you have private industries that give local health fairs. And it's not necessarily a fair where you they vary. Okay, they vary in which they provide the various preventive care options that are available on site. And then you also have some places which um, they give you information of knowing where to gain some of those resources. And those are the larger health events because they want to expose you to what's available. And then you can make that choice of where you deem is best for you because you know your health better than anybody. So that's one of the things that I want to kind of talk to first. So I'm going to put that one to the side and hopefully I can give you some more insight on it. But that was just a quick form of information about gaining a deeper insight into important health topics and how it directly impacts you and your community. The second item that I want to discuss is elevating our discourse, the way that we communicate, the way that we identify and get information so that it can empower us to advocate, to be on, say, hey, this is what I need, so that you can have a better informed decision in your own healthcare. And you can seek out multiple places that you can get this. Mm. You have local community health forums that actually occur in some areas. And I can't tell you where because it differs from area, but it gives you an opportunity to sit down and listen to local healthcare providers and practitioners who are in your area. And they sit down and discuss and talk about what's happening in the area, what's going on. It's kind of like a town hall meeting, but it's not on the politics of it, but it's about the healthcare part of it. The other way you can gain more insight on your decision making is attending seminars about health. You know, that's one thing that you can get from some of those event sources of how you can find out where the events are in your area. Try not to name drop some of these places, y'all. But when you do something like that and you attend some of those seminars, you learn, you gain insight, and it helps you get more informed about how it can best suit you and your health. And of course, I'm going to be partial to it. There are some really good podcasts out there. You just have to figure out which one is the best for you, which one has the best services for what you're looking for, who's been vetted, making sure that there are true practitioners who are out there. When you do something of this nature, it really, really helps who you are. It allows you to learn more about the medical advancements, the treatment options that are out there, the public health policies that are out there. That's the reason why I say it's important to advocate for yourself, but be informed in how you advocate for yourself. So that way you can make an informed decision about your own healthcare. Because the more informed you are about some of the medical advancements, okay, let me give you an example. If a person has cancer, they have clinical trials. We did have a physician who talked about that. And he said these particular clinical trials are literally that, the clinical trials. There are options where They know that it could work, and they want to seek out what's best and what could help someone later on. So when you learn more about some of these optional treatments from a qualified health professional, then that gives you more insight as to how you can get and seek better care. Treatment options can even go with dentistry, because we have several people that I've talked to recently that each of the dentists have some specialties. They it's not just cleaning, okay? They do root canals, they do bridge work. They do multiple options. And then we talk about the public health policies. That gets into the depth of the political world, but it's okay to learn and find out how it's affecting you. We're talking about Medicare, Medicaid. You're talking about your own health care, your health insurance, because your health insurance tells you what you can get, what you can't get, whether it's approved or not approved. And then you can also see how some of the policies are around your care. So that's why I said you have to look collectively into everything that's going on. Um, so that's why I wanted to bring that up. When I have these guests on, they are giving us an opportunity to delve deeper into what's actually going on. I give you some research. Sometimes I'm able to give you some studies that talk about some of the advancements that they've had, some of the things that have gone really, really well. And then you can go ahead and learn how they can help you when you talk to your primary care physician or you talk to your specialist, because that's what they're there for. They're out there to help you in that process, to learn more about what's good for you, how it can best suit you for your health needs. Okay. The next one and the third one that I want to discuss is actively participating in discussions. And when I talk about discussions, I'm not talking about the gossip. I'm talking about an actual discussion with your healthcare provider or your specialist. Some people see functional and integrative specialists. Some people see a gynecologist. Some people see an ophthalmologist, dentist, an ENT, ear, nose, and throat physician. You see all kinds of people out there, okay? We're talking about those kinds of discussions. You're talking about yourself. You're trying to show that you have a sense of responsibility for your own health and that you want to take an action toward your best health. It's called collective action. That's what it's called. And when you share your experience of what's going on, or you share your experience with somebody else, and you know what, one of the fun things is that with me being in healthcare and with having been a caregiver as well, sometimes I was on a hunt for a certain physician for a certain thing. So I would reach out to someone that I knew, I'd be like, hey, I know that you're dealing with a situation with your mom in regards to XYZ. Is there a way that you can give me your doctor's name? What better place than to get a good physician from someone who actually uses it? So that's what I'm talking about, sharing your experiences. Saying, if I'm having difficulty with finding caregiving for someone who has dementia, go to a friend who you know or a friend of a friend who is seeking assistance. Because if you share your experience of how some of the difficulties that are out there are support groups out there for people who have these experiences and need support. There are forums which are out there that are legal and that are good. Okay, they're sponsored by physician offices, they're sponsored by 501c3 nonprofits that help you to ensure that you're getting what you need to have. And the reason I bring up sharing these discussions and sharing these experiences is because when you do that, you can see whether or not there is equity and accessibility out there. When we're talking about health equity and health accessibility, we want to ensure that we're building a healthier community for everyone. And one of the things that I realized is that having lived in both of the areas, urban, suburban, and rural, and worked in those places more say, there are differences. Because when you have a small local hospital, they may not have all the specialists that you need. And that's the purpose of having to travel and go somewhere else to get those services. But if they don't have it, doesn't mean that you can't get it or you can find ways that they can bring it in for you for accessibility, because we want to have that. That's the reason why you see sometimes on the road the mammogram bus. I'm sure you've seen it. It's a bus that rides around and they go into some of the local communities to ensure that women can get their managed care for their mammograms. There are some traveling dentists. Believe it or not, I met someone, not recently, but I met this one young lady who she works. I don't know how she does it. She just makes sure she has the water, she has a filtration system and does all this good stuff. And she actually cleans other people's teeth in a local area. So for example, let's say it is a nursing home. I'm just using it as an example because actually I did remember reading one that did have a dentist go into a nursing home, and they actually assisted living facility, should I say, because most of the people are very active, and the dentist came in, hooked everything up and cleaned teeth. That's what I'm talking about, providing that accessibility for other people. And the only way we can do this and promote this care is by talking to others and having those discussions about health equity. Because we have to understand, a lot of people who are in the urban areas in your county, you may have 4 to 7 hospitals within your own county, believe it or not, because the county is so large. But then again, we can go to the opposite where you may have 7 counties and only one hospital. So that's why I said you have to look at it and see, how can we promote this health equity? How can we promote this health accessibility? And that's one of the things that you are there to learn about. Now, the positive thing, I'm going to give you just a hint of one thing that I do know, that they do have a community needs assessment. Most areas have a community needs assessment that evaluates what's in your area. And when they have a community needs assessment, it talks about the things that are there, the things that they plan to do. When I think things, I'm talking the initiatives, the plans that they have, the strategic plan that they have in place. Hospitals have strategic plans, y'all, because they want to see their communities succeed and have healthier communities. And so most hospitals have it accessible, so you can read what their plan or what their intent is for their to gain that accessibility, to create that health equity. And we'll talk about that later. I'll probably even just go into more depth about that. So I wanted to expose you to those 3 areas where we focus on how we gain a deeper insight, such as our local healthcare resources, preventive options, and community initiatives, how we can focus on being an advocate for ourselves when we talk about our decision making. And the last one is the discussions themselves, sharing our experiences, supported initiatives. So we're promoting health equity and accessibility so we can have a better community for not just ourselves, but for everyone. Because when we're healthy and we have people who are healthy around us, we live longer and we do better. So I leave you with this. I want you to take action today. I want you to start seeking knowledge so that you can find out some of the platforms that are there, some of the seminars, some of the health forums, some of the communities. I want you to engage in those different types of conversations because they do matter to who you are. When we do this, we elevate our own health discourse. We empower ourselves with the knowledge. We empower ourselves to be advocates for a better health outcome for our community. And we want that. We want to make a meaningful impact. And that's one of the key things that I really and truly want everyone to know. And when we do that, it goes back to one of my sayings. I said, to one's health and cognitive happiness. I say that because when we do best for ourselves and for those who are around us, we build our brain health. And that's what keeps us going. That's what keeps us going. And when we're happy, we are healthier. So I want to build that type of empowerment and that type of health discourse. So that's what exactly we'll be focusing on this summer, is how can we make an impact? And I'll be focused on forms of literacy so that you can understand some of the terms that are being used in the podcast. And I just invite you, stay informed, stay powerful, stay in tuned on how you can best serve your health. Until next time, this is Dr. Jewel White Williams with Cold Press Conversations. I'm your host. I want you to take care. I want you to remember that knowledge is power when it comes to your health, and that I want you to have happiness, cognitive happiness, and have great health. Take care. I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off. to health and cognitive happiness.